Error. Electricity in line. Override accepted. Infusion initiated.
Welcome to the INS Infusion Room, the official podcast of the Infusion Nurses Society. In this podcast, we explore all things infusion therapy through a real-life conversation, covering the latest trends, new research, evolving standards, and key industry insights. Whether you're an experienced infusion nurse or new to the field, we aim to keep you informed and empowered with the knowledge to stay at the forefront of the profession. My name's Derek, and I'm your host. Let's dive in. Hello and welcome to another episode of the INS Infusion Room. Today we have Louise Esterhuizen in the studio today, and she has a lot to say about practice where she's from, which is in South Africa. She's a nurse practitioner, and she's driven by passion, perseverance, and purpose. So welcome to the studio, Louise. And if you don't mind, provide our listeners with a little bit more history about your professional experiences and what got you to where you currently are.
Hi, Derek. It's been quite an interesting journey for me because I started as an OR nurse in the operating room, and I never thought that I would actually end up in vascular access and feeling so passionate about it. So I've been fascinated about it, but something actually as simple as vascular access can make such a big impact in a patient's outcome. And it's the way we actually do the insertion that can actually have a prolonged effect on the patient's journey, and especially if the insertion was easy or more complicated, or if we chose the right device. So it was fascinating for me. I must just say, when I began my journey working with the industry partner in another country, I saw what best practices look like. And I saw what well-trained teams can actually, how they can make a difference in the patient's journey. And when I came home, I realized, wow, I've got lots
This
of
is where
work.
you wanted to be.
Yes, and this is where I can make an impact as a nurse. And this is where nurses can actually lead the way and change things for the better for the patient.
Well, thank you for that. And, fast forwarding a few years, you were inspired to lead change within vascular access and infusion therapy within South Africa. I know we talked a little bit about this in a call before, but can we talk about how you're advocating to expand the nursing scope of practice within South Africa involving vascular access and infusion therapy?
Well, it's been a bit of a back and forth road because we tried different avenues. We tried doing it on our own. We tried everything. And it was actually when I started talking to the physicians, because they only see vascular access as a medical procedure only. And they are a bit hesitant. Also, because our nursing council doesn't allow nurses to actually place central lines. So the physicians are actually hesitant to allow nurses to take those critical decisions. But I know it's working internationally and it's best practice. So, and I felt so isolated. And I felt as if I'm fighting an uphill battle. But I believe that nurses have the skill. If they've got the training and the passion, they can take on these roles very safely.
You talk about an uphill battle and feeling alone. What
Yes.
has been your strength in leading change whenever you are battling alone?
You know what? It's actually finding my people globally. That was the change. Seeing that I'm not the only one that actually fight this battle. There's mentors, people in INS, Wakova. We are not fighting the battle alone. There's a huge community of passionate vascular access specialists. We are all fighting this fight together. So that made the big change, the support that I've gotten from the INS, from the international fraternity, that made a huge difference. It actually gave me wind under my wings.
Oh, that's wonderful to hear. And it is so correct. Finding your people and your tribe is important as we venture out and look for those support systems that help guide us on those most difficult days. Change is hard, right? Battling and advocating can be challenging as well for a clinician, for patients, and or just policy change in general. So yeah, I share those sentiments, and I think that we all as clinicians can share that, because I think we can all reflect back to a time where we had to look for others and our people to help keep us moving forward and fueling us to continue. So,
Yeah.
talk a little bit about the current clinical setting. So, you talked about physicians resistant to change, but you as a nurse, what's guiding you to make the change? Or is there poor clinical outcomes that you can expand on that's helping fuel you to make these changes?
Yes, the current state in vascular access and infusion therapy in South Africa is actually it's far behind the times, and we are facing serious challenges of CLAPSI rates, frequent catheter replacement protocols, and a lot of doctors aren't using ultrasound for access. So they're doing vascular access without ultrasound guidance. And many of the central devices actually doesn't end where they're supposed to end in the cable atrial junction. So they end high in the SVC, and that's where a lot of complication risks are coming through, and a lot of occlusions. And it's standardization is key, and to be able to take what the INS provides and implement it in South Africa so that we've got standards and protocols that's matching the international protocols makes a huge difference. And we're trying to implement these international practices, but we're fighting an uphill battle because there's no standardization. In different facilities have different protocols. So there's nothing standardized, and they don't use the evidence-based clinical evidence to actually standardize their protocols. And it's a sad reality.
Yeah. And the questions we get is why standardization? And like you just said, the evidence is there. Why not? If we have the evidence, why are we not following and ensuring or working towards the best outcomes within patients' plans of care? Right.
Absolutely. Fully agree with you. And that's why we need structured education and policy alignment. But we also need recognition of the nurse's role in driving safety and quality, because we can drive it. We just need the support.
So, talking about bringing the infusion therapy standards of practice into South Africa, what are some of your strategies for implementation or using that within practice currently? You said that there's policies that don't mirror current standards. So, what are your strategies for making that change?
Well, the strategy is actually to use pilot studies and to pilot in certain hospitals where we've got the support of the clinicians, where we've got the support of the doctors, and use that evidence to actually prove to them that there's a better way. So currently we're leading with two major hospitals where we're implementing best practices, where we're implementing catheter to vein ratio, selecting the right devices, and showing them the result of less complications, less thrombosis, all of those. So we're trying to lead the way with pilot studies and pilot hospitals so that we can prove to them that the evidence is there, the evidence is international available, and we just have to implement those standards into our daily protocols and the way we care and manage these lines, because there's no protocol for that. I've found mentors and colleagues who are already doing what I'm of doing. And I'm following them and I'm leading by their examples and using vascular access programs and training protocols to actually train the nurses locally so that they use the evidence-based practices to actually care and save lives.
Yeah. And as you expand scope of practice, a common theme is that it's one discipline against the other discipline. And that's not what we're trying to do here. When we expand scope, it's to allow more collaboration between the disciplines, right? To enhance the patient's experience, to enhance those outcomes by having a more focused skill set or more purposeful skill set, if you will, to be extra hands within that patient's plan of care. So I think that there's this underlying stigma about the battle between the professions, but really we're all working towards the same purpose, right? Is to provide the best care that we can and have the best outcomes. So sometimes we need to expand programs to allow for that to happen.
Certainly.
What are your current battles that you see within that? Do you find that certain disciplines within your healthcare are concerned about the scope of practice expansion and taking away from their current practice?
I've definitely seen that because traditionally nurses are not allowed to place central lines in South Africa. Doctors are hesitant because our current nursing council don't allow us. They don't see it as part of our scope of practice. So I actually thought, or what I've done is I've incorporated the multidisciplinary approach. So we've got doctors, clinicians, we've got critical care technologists that works in a multidisciplinary practice so that we can look at the best for the patient. And it's not about us, it's about the patient. It's about a better outcome for the patient. And we are all passionate about vascular access and to provide a better outcome for the patient. So it's working actually very well towards evidence-based and towards better outcomes and longevity of our devices.
It's great to hear. It's vascular access and infusion therapy. They are their own specialty. And I think that if you are currently within practice and it's always been part of your practice, and maybe for a nurse within the last 10 years within the United States, they've always seen vascular access as a specialty. I can remember a time where nurses in the United States did not place PICC lines, right? Midlines were emergent within practice. So there's been many, many changes. And we take that for granted sometimes that not everyone has the same perspective whenever we're looking at other countries or where we are with current practice, with legislation, policy. We're all at different levels, right? And I just think it's wonderful that you are trying to make those changes, implement a positive change to truly impact your patients within South Africa, and leading by example. So thank you for your efforts.
Thank you. It's been difficult,
Yeah.
but it's been worthwhile. It gives me energy and it ignites my passion even more if I can make a difference in those patients' lives, because they are the ones that carry this device for their therapy. And if we can have one device for the full duration of their treatment, then we've managed vascular access on another level and we enhance their experience.
So what's next for you? What are you currently working on and what's coming up?
So, what we're doing is we actually want to present training, and we've taken the INS standards of practice and the WACOA principles and safe insertion protocols that we get from WACOVA and from GlovaNet to implement and translate them into small workshops where we implement the procedure, where we implement safe vascular access with ultrasound, where we actually do the insertion techniques, the tip tracking, because tip tracking is such a profound part of placing a central line. So we're using all the techniques, all the technology that we can actually use to make it better and safer for the patient. And we use our multi-practice. So we've got doctors that do the insertions and critical care technologists, and then our nurses are the support. So we help to make the placement a sterile procedure in a sterile room. We prep the patient. We give them education on line care and online management, and make sure that the evidence is there. We just implement it in South Africa, and we can prove that when we implement it correctly, that the patient have a better outcome.
Yeah. And I know that you have some international travel coming up and presenting, right?
Yes, so we are planning I'm actually traveling to Turkey, but just for a workshop tomorrow. And I hope that it's going to be the first of many international engagements.
I know we look forward to continue to partner with you here at INS and helping you in any way we can, or any way the INS can, with the available resources. So continue to keep fighting that good fight. Before we end today's episode, do you have any final thoughts or words of wisdom for anyone that's listening?
Well, I think what we should do is, when you have a passion for vascular access, you must ask yourself the question why, and find your purpose and pursue your purpose, because this is how it started for me. I wanted to find my why, and I stumbled onto vascular access. And my purpose is to change things in South Africa and to be the leader for our continent, and to promote change and to promote better skills, better safety, better technology, because it's such a big part of a patient's journey is vascular access. So if we can do it better, why not?
Thank you for that. And again, thanks for tuning in today. As always, I'm your host, Derek, and it's been a pleasure sharing this important discussion with you. Remember, knowledge empowers us to make informed decisions. Until next time, stay informed, stay curious, and keep gaining knowledge. Thank you for tuning in.
Infusion complete.